This video explains what anal cancer is, its causes, symptoms, tests, and treatments. Anal cancer is a rare cancer that affects the anus. The anus is where your bowel connects to the outside of your body, the bottom. Anal cancer can start in any part of the anus. Most cases are usually linked to an infection called human papillomavirus, or HPV. Getting the HPV vaccine can help prevent anal cancer. How serious anal cancer is depends on where it starts and how big it is. It also depends on whether it has spread and your general health. Early detection and specialist care make a big difference. Next, we cover common symptoms to watch for and how testing works. If you have concerns, speak to your GP. Don't ignore symptoms. Anal cancer may have no symptoms at all, or symptoms can be hard to spot. Common symptoms can include bleeding from your bottom, itching and pain around your anus, small lumps around and inside your bottom, a discharge of mucus from your bottom, problems controlling when you poo, bowel incontinence, needing to poo often with looser, runnier stools. These symptoms are often similar to piles, hemorrhoids, or anal fissures, which are more common and less serious. If you notice symptoms, contact your GP so they can check. The GP can refer you to a specialist if needed. Don't delay seeking advice. Most anal cancers are caused by human papillomavirus, or HPV. HPV is a common viral infection, and most people with HPV do not develop cancer. You can get HPV from any skin-to-skin contact of the genital area, through vaginal, anal, or oral sex, from sharing sex toys without cleaning or protection. You may be more likely to get anal cancer if you have anal sex. Age is a factor. Risk increases in older people, especially over 75. Smoking increases your risk. A history of cervical, vaginal, or vulval cancer can increase risk. A weakened immune system, for example due to HIV or an organ transplant, also raises risk. Anal cancer is rare. Most people with HPV will not develop it. If you think you may be at increased risk, talk to your GP about screening, vaccination, and support. The HPV vaccine is one of the best ways to protect against anal cancer. All children aged 12 to 13 are offered the vaccine. It helps protect against cancers caused by HPV as well as genital warts. The vaccine is also recommended for men aged 45 and under who have sex with men, trans men and trans women up to 45 if their risk is similar. It's recommended for sex workers, and for people living with HIV. Practicing safer sex and using condoms can lower HPV transmission. Avoid sharing sex toys or clean them thoroughly between uses. Stopping smoking reduces general cancer risk. If you're eligible or unsure, speak to your GP or local clinic about vaccination and other ways to reduce risk. If your GP refers you to a specialist, you may have tests to check for anal cancer. This can include putting a thin tube with a camera into your bottom to check for changes, taking a small sample, a biopsy, to examine under a microscope. You may also have blood tests and imaging scans. You should get test results within a few weeks. Contact the hospital or GP if you are worried about delays. A specialist will explain the results and the next steps. Bringing someone with you can help. A team of specialists will plan your care, and a clinical nurse specialist will be your main contact. The main treatment is a combination of radiotherapy and chemotherapy called chemoradiation. Chemotherapy is medicine to kill cancer cells. Radiotherapy uses high-energy radiation to target cancer cells. Your team will explain benefits, side effects, and help manage any changes, including to your diet. Surgery may be used if chemoradiation isn't suitable or if cancer remains after treatment. If needed, a colostomy pouch may be fitted to collect poo. You'll have regular checkups and support. If you have symptoms or side effects, contact your specialist team. You don't need to wait for your next appointment.